So Councillor Corby, can you ask your question as submitted to Councillor Smith?
Thank you, Chair. The recent performance report for Q1 24 to 25 highlighted that only 6 of 33 education, health and care plans have been completed within the 20-week time frame, equating to 80% of the 90% target. Clearly this is of concern to us as councillors, but most importantly to the parents and carers of those children waiting for an assessment. Can you please confirm that the remedial measures put in place have had the desired effect? And what are the current figures relating to EHCP completion?
Thank you. As Councillor Smith is not present, I believe Councillor Waller, that you can be providing a response.
Yes, thank you, Chairman. I am going to respond due to Councillor Smith's serious illness. Councillor Corby, can I start by thanking you for your question? I'd like to explain that RCC is not totally in charge of our own fate over the timeliness of the production of the education, health and care plans. For example, schools contribute to these, but if it's a school holiday period, the schools aren't available, for example. Having said that though, we did start this quarter with a backlog due to staff shortage during the autumn term of 2023. And this was caused by staff leaving or taking up new positions within our organisation. And this affected the statistics in January 2024. However, the percentage has been slowly increasing. Agency staff have been allocated to support with this work, and there is now a full team trained and able to support going forward. The delay was also contributed to by the lack of capacity for educational psychologists face-to-face assessments. And we're working with our providers of the education psychology service to ensure that capacity is increased. We've also created a system of triage, so those that were able to be completed remotely, and I did mention the face-to-face previously, were carried out remotely, and this helps with educational psychology assessments being completed. In August, in August, the statistics for the year has now risen to 23%, that is 11 out of 47 completed in the year, with within the 20-week timescale. In August alone, 44% of EHCPs were within the statutory timeframe, so the statistics for the year as a whole should continue to rise. Between January and June 2024, whilst only 16% were completed within the statutory timescale of 20 weeks, a further 41% were completed within 21 to 30 weeks. Currently, approximately 20 out of 40, i.e. 50% of the assessments are on track. At the recent parental collaboration group, we explored whether parents would prefer the SEND team to prioritise a complete holistic assessment and plan, or one that is completed with less information but meets the 20-week timescale. All thought that parents would prefer the former, so long as the reasons for the delay were explained clearly to parents. All agreed that it's preferable a placement be named as opposed to a type of placement, even if this meant a delay. I would add that the SEND service has only had 2 complaints for the whole of this year that refer to timescales, and one of those was linked to the annual review, not the initial assessment and delivery of an EHCP. Thank you.
Thank you, Councillor Waller. Councillor Corby, Do you have a supplementary?
Yeah, thank you, Chair. Yes, I do. It may have been answered there, Councillor Waller, but I was going to ask, there were also issues at that time relating to placement. Might be a bit unfair because Councillor Smith's not here, but I just wondered if there's an update on the issues relating to placement of these.
I don't think that would be classed as a supplementary. I don't know. I'll just check with Seb. Yeah.
If it's related to the matter of Councillor Waller.
Thank you. I will.
Yeah, thank you. I can't give you a full and detailed answer to your question in terms of how many were related to it and so forth, because clearly it is Councillor Smith's portfolio, not mine. What I can tell you is that delays are often caused about placement, because clearly parents have the right to express a preference. The actual placements themselves, the schools have a view on whether a young person can be placed or not. And if the school's on holiday, they're not going to give their view, so a delay gets built in. So that's why there are delays often. It's not because the council can't find anywhere, it's the matching the placement with the young person and their needs.